When someone's diagnosed with an eating disorder, the next question they often have is, why did this happen to me? Or why did this happen to my child? It's normal to have these questions, and in today's video, I'm going to be going over the why, the causes, what happens beneath the surface that results in an eating disorder, and why it's so much more than just a diet gone wrong. So I invite you to watch this video if you're curious to know more about your eating disorder and what factors may have contributed to its development and it continuing. Managing an eating disorder can be a lonely journey. For in-depth information and strategies for managing your eating disorder, subscribe to the channel and hit the bell in the corner so you're notified when I publish a new video every Wednesday. I'm Meredith MacKenzie of Parallel Wellness. I'm a registered clinical counselor, eating disorders therapist, and doctoral graduate student. And if you've watched any other videos on my channel, you'll probably recognize that I'm not in my typical space for today's video. And that's because I'm on the road. A week ago, I finished my pre-doctoral clinical residency program. That had me living in St. John's, Newfoundland, Canada, and now my husband and I are on our road trip across Canada to get back to British Columbia where we live and where Parallel Wellness is. But I didn't want to miss uploading a video this week, so I'm doing it from our hotel room. So in my work with hundreds of clients with eating disorders, I've helped them to loosen the grips of their eating disorder and find freedom from food and compensatory behaviors. Now it's your turn. Before we get started, I want to provide a disclaimer. While I am a registered clinical counselor, the information in this video is for educational and informational purposes only. If you are concerned that you may have an eating disorder, please seek the support of a professional that's trained in eating disorders, such as a physician or a therapist. I'm going to be covering causes and factors that are contributing to eating disorder development and maintenance. Will all of these factors apply to you? No. Could they? Absolutely. The information that I'm pulling for today's video comes directly from empirical research that's available to everyone, but as a therapist and a graduate student, I have the privilege of this research being more readily accessible to me. The majority of research is conducted with binary genders and sexes, so they say men and women, and they don't talk often about transgender people or any other ways that people may identify themselves. And for this reason, research can be quite limiting. The other point is the majority of eating disorder research tends to be done on women. Eating disorders have traditionally been known as a women's disorder. While we know that that's not the case, there are not a lot of research studies to include people who identify as male. As we start discussing the causes of eating disorders, it's important for you to have a bit of an understanding of the biopsychosocial model. The biopsychosocial model has been really important to research in understanding mental health and physical health. Essentially, what it tells us is that eating disorders cannot be broken down into understanding them just based on the environment that you were raised in and anything that you might have been exposed to over your lifetime versus the genetics that you were given at the time you were conceived. Historically, research has tried to drill it down to one of these two things, and modern research has come to the realization that it's not just one or the other, but the two interplaying together. And unfortunately, this is what also makes eating disorder treatment much more challenging. So many people ask me, is there a genetic component to the development of my eating disorder? And researchers have been busy trying to find out if there is a genetic component to eating disorders. Now, what they have found is that there's no conclusive evidence that there's a single gene that causes an eating disorder to develop in a person. However, the evidence does very strongly suggest that there is some type of genetic component underlying the development of an eating disorder, but they also believe that the eating disorder comes from an interplay between genes and environment. And I'll be mentioning this throughout the video, and essentially what it is that we may have a genetic predisposition to an eating disorder, and then based on the environment that we're raised in or things that we experience throughout our life, those experiences then cause the expression of that gene to happen, or, as something I'm going to talk about a little bit later, epigenetics, which is when the genes change how they're expressed based on the environment or things that they're exposed to. And I hope this makes sense as we go along talking about the different factors. If you have any questions, please leave me your questions in the comment section down below and I'll be happy to respond to them. The research shows that idealization of thinness is a big contributing factor towards the development of an eating disorder. In North American society, which has then influenced countries throughout the world, we're exposed to a thin ideal through the media that we consume. We experience pressures from our loved ones and other people in our society to be thin, or that thinness is the best way to be. And then from there, we internalize this ideal into ourselves, strongly believing that we are better when we are thinner. Another social component of this is that there are a lot of expectancies that we associate with thinness. That when I am thinner, I will be happier. When I am thinner, I'll be more attractive. People will like me better. I'll be able to get that job that I want. I'll be able to wear those clothes that I want. So we really hold thinness up to this high expectation of what this future life could be if we were to achieve this thin ideal. And the research shows that both anorexia nervosa and bulimia nervosa increased in frequency as the thin ideal increased across North America. And if you look at the research over time and across cultures, based on the exposure to the thin ideal in North American media, there's been an intercultural increase in anorexia nervosa. However, the same North American culture that does influence other cultures hasn't been found to also be correlated with bulimia nervosa. Research studies have shown that when you expose someone to the thin ideal, say through a magazine, it actually increases their disordered eating thoughts in the moment. And this is where understanding that gene-environment interaction is so important, because this is not to say that every person who's exposed to the thin ideal is going to develop an eating disorder, because we know that that's not true. We're all exposed to the same magazines, we're all exposed to the same television, we're all part of the same culture that does idolize thinness. However, we don't all develop eating disorders. So the belief is that you may be predisposed to it genetically, and then with this exposure to the thin ideal, that impacts the expression of that gene, and it may cause someone to start developing symptoms of an eating disorder. It's also possible, and I would say common, that people internalize the thin ideal to believe that that is what is best, and they may even be able to engage in dieting behaviors without developing a full-blown eating disorder. Research has also found that there are similar effects on people who identify as male. With exposure to the media, males who participated in these research studies reported increased body image concerns, dieting behaviors, and weight concerns. This all goes to show that what we consume and what we're exposed to in our environment, especially when we so highly value this thin ideal, is important. We are impacted. And so I encourage anyone who's watching this video to really take a hard look at what media they are consuming, who they're surrounding themselves with, and those messages that they're receiving, so you can create a more neutral environment for yourself that will be supportive of not creating additional pressure to internalize that thin ideal. Now, attached to this, but also separate on its own, is the advent of puberty in people's lives, and more specifically in people who identify as female. Research studies have shown that as women approach puberty, they increasingly internalize that thin ideal, and there's more pressure for them to do this. And this is very complicated when we consider how different each person's experience of puberty is. The body changes in so many different ways, often not gracefully, and it can be challenging for anyone in a new body or a very quickly changing body to reconcile all those changes at the same time as feeling pressured to fit into a specific ideal body type. This is also why I suspect that so many of my clients come to me around the age of 12 and 13. Not only is it the time that they're transitioning to high school and experiencing so many other changes, but this puberty onset is happening for them. The next factor that's associated with eating disorder development is personality. Personality or temperament is relatively stable throughout a person's life. And again, going back to that biopsychosocial model, personality traits have actually been found to be heritable, with about 40 to 50% of the variance in your personality being related to genetics. And the other portion can be contributed to the environment that you're raised in. So there are a few specific personality traits that tend to be more associated with eating disorder behavior development. The first is negative emotionality. And negative emotionality refers to how we respond to the environment that we're in and the variance of emotions that we're experiencing at a given time. Oftentimes, these people can be more sensitive to the environment that they're in, and then they also experience these situations more negatively than other people. And this might look like a disposition towards or more frequently experiencing unpleasant emotions such as anger, anxiety, these highly sensitive people. Another personality trait that's associated with eating disorder development is impulsivity. And again, based on the emotions that you're experiencing, when you feel an emotion, impulsivity is related to your quick, rapid reaction to those feelings, which fills you with a sense of urgency and might not give you a lot of time to pause and think and percolate, or give you a lot of time to consider how you would like to react in that situation, and so you might react more quickly. Impulsivity as a personality trait has been specifically linked to binge eating and purging behaviors. And the final personality trait that research has identified is perfectionism. If you're a perfectionist, you know that you may set high personal standards for yourself, and you can also be overly critical of yourself. The way this impacts eating disorder behavior is that you have this thin ideal, this high expectation, and the belief that you should be able to reach that and maintain it. So you set the high expectation for yourself, and then you can be quite hard on yourself or dissatisfied with your current body type. And perfectionism is also associated with rigidity, so focusing on a goal and going hard for it without considering the other extraneous factors that you might want to consider. So that also plays into eating disorder behavior development. Comment below and let me know if understanding some of these risk factors or contributing factors to an eating disorder has helped you to understand yourself and your eating disorder better. Eating disorders may also be caused by neurocognitive processes, which to simplify it means that there's areas of our brain that may be responsible for eating disorder development. And the first part of our neurocognition that could be related to eating disorder development is cognitive flexibility. This is our ability to move back and forth and to shift between ways of thinking and being. The research has linked this specifically to anorexia nervosa as well as bulimia nervosa. However, there's not enough research yet to make claims about this with binge eating disorder. The part that I found incredibly interesting about this research is that cognitive flexibility in anorexia nervosa throughout the time that a person has experienced anorexia. More specifically, really inflexible cognition or difficulty with shifting between things or rigidity in the way you're thinking about something has been strongly associated with the duration that somebody has had their anorexia and the level of starvation that they're at. And this might be something that you're recognizing if you have struggled with restriction, that the more you restrict, the more steadfast you become in restricting. And this is all linked to your cognitive flexibility. The other neurocognitive process that's associated with eating disorder development is inhibitory control. This is the process that we use to suppress our behaviors or to inactivate or override a response that seems like it's automatic with something that's less automatic or more purposeful. And this neurocognitive process is more related to eating disorders that are associated with binge eating behaviors and purging. So this could be related to bulimia nervosa or anorexia nervosa with binge purge subtype. So now we're going to dig a little bit more into gene expression and what I was talking about before about epigenetics. So what epigenetics is, in the most simplest way of trying to explain it, and I'm sure I'm still not going to explain it in a simple way because I'm still wrapping my head around it. When we are conceived, we are given a set of genes. And within these genes, we may have a genetic predisposition to developing an eating disorder. However, because our genome is wrapped so tightly within our genes, not all of those genes are expressed. And it takes very specific environmental exposures to have those genes be expressed. Essentially, it's like a lock and a key. If the experience happens, the key may open the lock and that gene may be expressed. However, if you don't have those experiences, then it may stay locked up. So you might have the genetic predisposition without actually demonstrating that you have an eating disorder. And as I said before, research in this area of epigenetics and eating disorders is incredibly young. So researchers are not making any strong claims at this time, but they have started looking at how gene expression and epigenetics might impact different neurotransmitters that are created within the body that then go on to impact eating disorder expression. The first is the connection between the environmental experience of the relationships that you have with your parents and how you're raised, and the gene expression for serotonin, which is a neurotransmitter that our bodies create that help us to feel happy and calm and content. And when we don't have enough serotonin, we can experience symptoms of depression, and it also impacts our development of an eating disorder. So the environmental factors within the parent-child relationship that have been found to impact eating disorder development are a very critical home environment. Feeling a lot of pressure, negativity, and criticism. It's also been associated with abuse from a parent. And what the research is showing so far is that people who have experienced this critical, possibly abusive home environment and have also gone on to develop an eating disorder, that these people have a lower production of serotonin, which they believe is connected to their eating disorder development and triggered by that home environment. Another way that researchers are believing that epigenetics may have an influence on the development of an eating disorder are the chemical hormonal changes that happen at the time of puberty and the onset of an eating disorder. There's promising research to show that people who develop their eating disorder in mid to late adolescence or in mid to late puberty, it may be the effect of a genetic predisposition to an eating disorder that is triggered by the onset of puberty. And in people who are biologically female, the belief is that it may have something to do with ovarian hormones, because these female hormones are actually very important in regulating the production of other mood hormones, including dopamine. On the flip side, one study has actually investigated the impact of puberty on people who are biologically male, and they found that puberty did not have an impact on people who are biologically male. So there may be something very specific that happens with our ovarian hormone development that causes this onset of eating disorders related to puberty. Now, unfortunately, to date, the research is not focused on trans females or trans males and any kind of hormone therapies that they may be on. So I'm really curious about the future of this research and where it goes to understand more about the development of eating disorder behaviors related to these genetic components and puberty. So in today's video, I reviewed several risk factors that are believed by research to be possible eating disorder causes. And I wish I had an easy answer for you so that you could feel more assured, but eating disorders are complicated disorders and there's not a single cause. Stay tuned for next week's video, which will be published on Wednesday, where I'm going to be talking about the things you really do not want to be saying to anybody with an eating disorder. I want to help you become a better ally and support system for this person in your life. Now, if you're looking to get started on your eating disorder recovery journey, I've created a mindful eating log, which I use in my practice with eating disorder clients all the time. I've provided the link in the description box down below where you can go and download a copy of this mindful eating log for yourself. Now, you're going to want to check out the rest of the videos on my channel on eating disorder recovery and understanding your eating disorder. So I'm providing a list of links in the description box down below where you can go and watch those now. Finally, if you've enjoyed this video, hit that like button, subscribe to the channel, and share the video with anyone you know that is suffering from an eating disorder, is wondering more about why their eating disorders happen to them, and could benefit from some insight on that. I look forward to seeing you in the next video on Wednesday.